We suggest you pause this video often. It helps to study the slides.
Hi, I'm Allison Dreher. I'll be conducting the video homework assignments for our Fertility Awareness 101 course. This is the first homework assignment. We are going to begin by reviewing the male and female reproductive systems. You have all heard most of this before, but it's important to keep in perspective when we begin discussing the menstrual cycle and fertility in later videos. We will begin with the male reproductive system. Most of the male reproductive organs are outside the body. That's because sperm cells need to be developed at a temperature lower than normal body temperature. The scrotum is the pouch which contains the two testicles. This is where sperm cells are developed. Billions of primitive cells in the testicles will develop into sperm cells. Each of these primitive cells is capable of producing 4 mature sperm. This takes place in tiny tubules. In addition to the sperm cells, there are other cells lining the tubes which act as nurses to the developing sperm. They provide nutrition and protect the sperm from being destroyed by other body cells which consider them to be foreign intruders. The nurse cells also secrete a fluid to transport the sperm to the epididymis, an organ which lies on top of each testicle. In the epididymis, the sperm cells mature and become capable of moving by themselves. They remain there until the time of their release or ejaculation from the man's body. After the sperm cells are released from the epididymis, they travel through an elongated tube called the vas deferens, which joins the urethra. A special fluid called seminal fluid is secreted by the seminal vesicles, prostate gland, and Cowper's glands. Seminal fluid joins with the sperm. Sperm plus seminal fluid is called semen. Both urine and semen pass out of the body through the urethra in the penis, but a special valve between the prostate gland and the bladder closes to prevent the urine and semen from mixing during ejaculation. The penis is made of spongy tissue. When a male is sexually stimulated, he may have an erection of his penis, which widens, lengthens, and hardens as it becomes congested with blood. The penis varies in size from male to male, but is always adequate to have a normal act of sexual intercourse, which is the insertion of the erect penis in the vagina and the ejaculation of semen. Each ejaculation of semen may contain up to 500 million sperm cells. Sperm cells are constantly being developed so that a man is always fertile and capable of fertilizing an egg. After the sperm cells leave the man's body, they will normally live only a few minutes or hours. However, sperm may live up to 3 to 5 days if deposited in a woman's body when she is fertile around the time of ovulation. A fairly high concentration of sperm is also in the discharge released from the penis before ejaculation. This pre-ejaculate fluid, known as Cowper's fluid, seeps out of a man's penis when he is aroused. Unlike ejaculation, the man cannot control the emission of this fluid. For this reason, any contact of the male genitals with the female genitals, even without going all the way to full genital intercourse, can result in a pregnancy if the woman is fertile at that time.